So we've seen that sometimes patients come to us because they don't like how their legs look. And sometimes they come to us because they want a better life. And other times they come to us because they want their legs to feel better. But there's another group of patients who we treat because they're going to get into trouble if we don't. Especially in elderly patients who have bulgy veins down at the bottom of their leg or their foot, those veins can sometimes bleed without any injury at all to the leg. And unfortunately, that bleeding can be pretty alarming. It happens mostly when people are coming out of or are in the bath or the shower, and the blood can actually shoot across the room. So you can imagine that this is pretty scary for people. A phlebologist can do a minor procedure and prevent that from ever happening. But for all of those who do have bleeding in their veins, don't panic. Remember one word, and that word is gravity. So lie down, put your foot up in the air, and let gravity drain the blood out of it. Push really hard over the spot that's bleeding until it stops, and then call a phlebologist. Another type of trouble that our patients can get into are the development of those ulcers that we saw a few minutes ago. Now remember that this is not an overnight thing. It happens over many years. First we see the brown discoloration of the skin, then the skin changes its texture and gets sort of leathery, and then a person can develop an ulcer. Again, a phlebologist can tell well in advance that you're headed down the road towards an ulcer. We can treat your veins and prevent that from happening.